Hello everybody, my name is Cameron and I'm your Aflac representative. The purpose of this video is to give you a very brief summary of how Aflac plans work. Aflac must be explained. You've probably seen the duck commercials, but they don't do a good job of explaining how it affects your lives and helps you out. So that I appreciate you taking a little bit of time to watch this, and I promise that after it's over, you'll have a very clear understanding of the plans and how they can help you out. You should have in an email an attachment of a Word document that is a summary of plans. It has a summary of each plan and the rates on a biweekly basis. If you don't have it, don't worry about it. You don't need it. And you also should have an employee interest sheet so you can take those out and follow along if you wish. This is just to tell you that I can't cover everything. You are going to receive a brochure that has all the nitty-gritty details of each plan. So how does Aflac work and how is it different than your other insurance? Well, it basically involves two big problems. If something was to happen to you or to a member of your family, a medical problem, especially if it's something serious like hospitalization or something like that, you're going to have two basic problems. The first one, you're going to have unexpected out-of-pocket medical expenses, deductibles and copays. We're all of a sudden confronted with having to take some money out of our pocket at the moment we didn't realize it. The second problem is that, especially if it's serious, you're going to miss some work. So a combination of no work or our ability to earn a paycheck has been taken away at the same time we have unexpected medical expenses. That is the largest cause of bankruptcy in this country. So what Aflac does is extremely simple. It just pays you cash after an accident or after an illness and maternity. It doesn't pay the medical facility. This is all money deposited into your bank. Think of it as a safety net that comes into your hands at the moment that you need it most. So you're about to see some slides with some benefits with numbers. Those are all money deposited into your bank. You decide what to do with them. Some very important things about Aflac plans that are very different than your other insurances. Number one, that the rates will never increase. So once you're enrolled in your plan, that is your rate forever. Some of the plans are based on your age. So the rate that you started at the age you are at right now, is the rate that you will carry with you for the rest of your life. So even as you get higher into the age bracket, the rate does not change. And also, these plans are portable. So if you ever leave your employer, you can take these plans with you. And this should be a part of everyone's portfolio. So instead of having it as a payroll deduction, they'll discharge you directly. That's one of the great things about this plan, is you can always keep it. You've got worldwide 24/7 coverage. So even if you're traveling in another country, for example, you still have the coverage. Aflac has next day pay if you use our online service or the app that you can download. You set up direct deposit, they will deposit the funds into your bank the following business day. You're going to receive a claim instruction sheet from me that tells you exactly how to file a claim, and these plans work no matter what other type of insurance you have. So it doesn't matter what you or a spouse has or what it covers. These plans very simply pay you based on what it says. So if you do have that summary plan, you could take it out. These are the 4 plans that are available to you. And these plans cover different scenarios. So think of it as a menu at a restaurant. You can pick and choose a plan or a combination of plans that best suit your needs. Or you can pick nothing at all. These plans are completely optional. So each plan has its own separate rate. You can cover just yourself for one and dependents for the other. It's totally up to you. So let's talk about the first plan, the accident plan. So this plan pays you after an accident and where you receive treatment. It could be on the job, off the job, even traveling in another country. It does not cover illness. So if you go to a doctor, it's 1 or 2 reasons you're either hurt or sick. So this only covers the hurt side. So it has a long list of medical events, and each medical event pays you. It's that simple. So for example, the emergency accident treatment, if you go to an ER, urgent care, or even a dentist because you busted a tooth, or a chiropractor because your back's messed up, anything like that where you have to get medical treatment after an accident, it's going to pay you between $125 to $205, depending if there's x-rays or not. It's also going to pay you a sum between $35 to $12,500, and that's based on the type of injury and how bad it is. Follow-up visits, physical therapy, $40. Hospitalization. So if you're hospitalized because of an accident, it's going to pay you a lump sum of $1,500 for the first day of hospitalization. And then every single day you're in that room, it will pay you $300. From day 2 beyond per day, $300 and there's no limit to how many days it will pay you. And those numbers almost double if it's an intensive care ward. So here's another page of the benefits. I'm not going to go through them all. You can read them yourself. I will highlight that there is a $50,000 accidental death life insurance policy built into the plan. So if you die in an accident, your beneficiaries will receive $50,000. Dismemberments, up to $50,000. If you're in an organized sport, all these numbers increase by 25%. Now, the wellness. Most of our plans have a wellness benefit, and this is quite simply a $60 payment paid to you once a year after you do something for the wellness of your body. And that is like a physical exam or teeth cleaning, eye exam, long list of wellness benefits. It's all done online. And with this, you do not need any type of documentation. And that is on per policy, so it's not per year. So these are the bi-weekly rates. As you can see, it's very inexpensive. And as I said, the rates never go up. Individual means that you're just covering yourself. One parent family means that you are covering yourself, and every dependent that you have is covered up to the age of 26. So once they're 26, they're no longer covered. Employee spouse, that means you and your spouse is covered. And then two-parent family means that you, your spouse, and every single dependent up to the age of 26 has the plan. Now, if you think about the yearly wellness benefit of $60, that covers, like if enrolling as an individual, that pays for like the first five pay periods of coverage, or the first 3 months of coverage. Or if you're enrolling as a family, that covers, pretty much the first, month of coverage. So you've got to make sure that you file those wellness benefits once a year. Now, the next plan is the hospital plan. And the difference between the accident and the hospital plan is that the hospital plan covers illness and maternity, not just accidents. So any type of hospitalization or just different types of care that you receive, it covers. So it doesn't have to be because of just an accident. It can be accident, illness, and maternity. So this is a great family planning plan. So if you're doing some family planning in the future, you go to a hospital, this will kick in. So it has 3 levels to it, of 500, 1,000, or 2,000. And that's quite simply how much you would be paid if you're ever hospitalized for whatever reason per hospitalization. It's that simple. It's paid to you, not to the hospital. It doesn't matter what your health insurance covers, and it doesn't matter where the hospital is. It also has a initial assistance of $100. So once you get there, you get an additional $100, and it pays $100 a day on top of the initial lump sum of the 500, 1,000, or 2,000. So, and also a $500 intensive care per day if you're in an intensive care ward. Rehabilitation units, additional $100 a day. Short stay, meaning that you're there for less than 24 hours, $100. It has other benefits that have not necessarily anything to do with hospitalization. You don't have to be hospitalized to get these benefits. So for example, the doctor visit, if you have even just a physical exam, any type of doctor visit, this will pay you $25 per visit up to a limit of 6 times a year. And then ER, lab tests, x-rays, as you can see, surgery benefits, which includes pregnancy under that benefit as well. These are the rates. As you can see, it's based on your age, a $500, $1,000, or $2,000 rate. If you consider the per doctor visit benefit of $25, that takes care a couple of months of the coverage. And remember, as I said, that once you're in a certain age bracket at that rate, you're locked in, and it doesn't go up as you get older. So you have to choose either a $500, $1,000, or a $2,000 option. The next plan is a plan that's near and dear to my heart. I've seen it in action many, many times. It's a very famous plan. It's the cancer plan. This is a financially devastating disease. And with today's technology, we're going to most likely survive, but it is an expensive battle. It creates a lot of financial anxiety during a tough time. So this is an extremely generous plan, as you're about to see, that's based on one specific disease, and that is cancer. And it's any type of internal cancer. If you have an external, like a mole or something like that, that's removed, and that doesn't kick in, but if it goes internal, that's the point where it does any type of cancer, including skin cancer, as long as it's classified as internal cancer. So the way it works, it pays an initial lump sum as soon as the diagnosis occurs. It's really important you understand how this lump sum, within the first year of coverage, it is a lump sum of $6,000. If it is a dependent, it's $12,000. Now that lump sum of $6,000 or $12,000 is growing by $500 a year. So every 2 years, this plan, the initial lump sum is growing by $1,000. So if you can do the math, if it goes way down the years, that initial sum would be very large. And this is the kind of plan that you keep in your back pocket. And hopefully that day never comes, but if it does, just the initial lump sum would relieve a lot of pressure on a person and on a family. Now, it has a cancer screening benefit of $100 a year. So every year it renews and you get an additional $100 if you just go get yourself checked, all the different ways that we do it for men and for women. And please note that that is per person. So if you are covering dependents or a spouse, it's $100 times however many people you're covering. So that's a significant lump sum that's a part of the plan if you just go get yourself checked. Annual care. So if there ever is a diagnosis, this plan for 5 years will pay you $300 after a diagnosis. Now, I'm not going to go through all the benefits. There's too many, but you see radiation, chemotherapy, that's $400 a week, or $1,500 a week if you have to go to a place to get it done, and the different types of chemotherapy. Here are the different types of other treatment that you do to battle the disease: stem cell, bone marrow transplant, $10,000, surgery, skin cancer, hospitalization. It pays $300 a day, $400 a day if it's more than 30 days, outpatient and home health care, hospice care, nursing services, reconstructive services, transportation, and lodging. Here are the rates. These are on a bi-weekly basis. And again, as you consider the annual per person screening benefit of $100, that takes care of a big part of the first part of the year of coverage for this plan. Now, the last plan is the critical care ICU. It is a sister to the to the cancer plan in the sense that it covers specific illnesses that are critical. And I'll show them to you in a second, but first I wanted to show you the ICU benefit. If you end up in an ICU ward for whatever reason, it is going to pay you $800 a day, or $1,300 a day if you're in there beyond 7 days. $500 a day if it's a step down the unit. And all these numbers increase by $2 per month. There are no lifetime maximums. So it has inside the policy an ICU policy, which means that if you go in ICU for whatever reason, this kicks in. Now here is the lumps. Here is the list of critical illnesses that it covers. Heart attack, stroke. Of course, these are the big ones that are financially devastating. And the lump sum is $7,500 immediately paid, or $10,000 if it's dependent. And once again, these numbers are increasing by $500 a year. So every single year you're under the plan, it's increasing by $500. Now, after you have a diagnosis of one of these these critical illnesses, then you go through the treatment: radiation, rehabilitation, physical therapy, occupational therapy, speech services, and those kinds of things. It pays you $125 a day. It also has a $300 per day hospitalization benefit if you are hospitalized because of one of those critical illnesses. It also has a heart procedure benefit up to $44,000. It depends on the type of heart procedure or heart surgery, ambulance, transportation, and lodging. I don't have the rates on this. It didn't fit, but on the rate sheet on the summary plans, it has the rates. And as you can see, it's age banded. Now, how do you enroll? You just fill out the employee interest sheet. You should have an email. If you don't have it, you can contact your HR or contact myself. I'll send it out to you. You send it to HR or to myself directly, and I will send you a link from our enrollment system that is called Everwell. And this system, you just log in, you create a login. It should take you about 3 minutes. You do an electronic signature, and that confirms you. That's how you confirm your coverage. I will send you brochures, and also, as I mentioned before, I will send you instructions, but how to file a claim. Thank you very much. This is my contact information if you need to write it down. It's also on the summary of plans and on the interest sheet. So please reach out to me if you have any specific questions, or if you just want some guidance. I'll ask you a couple of questions, and then you tell me a little bit of something about yourself, and I can guide you in the direction of which plans I think you should start with. Thank you very much for your attention. I look forward to getting to know all of you.